So you hurt yourself. I'm sorry. Maybe you cut yourself with a knife, maybe you burned yourself with your curling iron or hot oil, maybe you just stumbled down the stairs, but you have a scrape, you have an open injury to your skin. It could be a biopsy that was done at the dermatology office. In any of those situations, it's really important that you take care of this wound so that your skin will heal as quickly and nicely as possible with a smaller scar. So first and foremost, you want to wash the injury. You can use Hibiclens, which is available over the counter. You can use really any gentle cleanser. You could even use my face wash if you wanted to. Don't use hydrogen peroxide, don't use alcohol unless there's really dirt in the wound. Then sometimes hydrogen peroxide can be helpful, but both alcohol and hydrogen peroxide can irritate the skin and actually inhibit the growth of those good new skin cells. After you clean it, you want to dry off the area, and then you want to coat the area with my RESTORE Healing Balm. And you want to use a lot. You use a Q-tip and you just cover the injured area with the RESTORE Healing Balm. You want to keep that balm in place, and that's where a Bandaid can be helpful. If a Bandaid just isn't big enough, you can buy these things called Telfa, which are non-stick dressings. You coat the area of RESTORE, you put the Telfa on, and then you buy some paper tape and you put the paper tape over it to hold everything into place. If the wound is larger than a couple inches and it's on your arm or your leg, using an ACE wrap to hold the bandage into place and to sort of help with the healing process is a great idea. Don't sleep in the ACE wrap, just use it during the day. If you aren't sure if you need stitches, go to the emergency room and find out if you need stitches, particularly if the wound will not stop bleeding. Also, if you go to the emergency room and it's on your face and they say you need stitches, insist on getting a plastic surgeon. Just don't sit there all day and then let somebody who doesn't do this very often sew up your face. Request the plastic surgeon so you can get a good outcome. Once you have your ointment in place, your bandage in place, that's something that you have to change on a daily basis. And if the dressing gets wet during the day because you did dishes or you took a shower, it's important to take it off, put a new layer of RESTORE Healing Balm on, and put a new Bandaid on. Even though this is not what you were taught growing up, and everyone's always surprised when I say it, letting a wound dry out and form a scab is not good for the wound. When the wound is dried out, it's harder for those new baby skin cells to divide, multiply, and get into place. So you want to keep the wound moist. And even though it looks gross, and even though it's yellow or white and gooky looking, that's actually great for the skin for the healing process. It's also important for you to know to throw out your Neosporin, your Polysporin. Those are over-the-counter antibacterial ointments that have been available for so long. The vast majority of bacteria are resistant to them. So they're not going to kill off the bacteria, but the rate of allergy to them is rapidly increasing, and I see an allergic reaction to those products on a regular basis. So get rid of the Neosporin. If you're worried about something becoming infected, Hibiclens is incredibly effective at killing bacteria, or call your doctor's office and see if you need oral antibiotics. But over-the-counter antibacterial ointments like Neosporin are going to do more harm than help in the vast majority of people. All you need is to wash the wound, dry the wound, cover it with RESTORE Healing Balm, put a Bandaid or some sort of protective cover on it, and do that every day until the wound transfers from being sort of a mushy mess to intact pink skin. At that point, you can stop the bandage.